back everyone to first meeting. And I'd also like to welcome Alex Scott as well to his first Board of Health meeting. I think he's introduced himself to everyone in the room, but for those online, you might not have met him yet. So welcome, Scott. Alex, sorry.
Happens all the time. Two first names.
And then I'll turn it over to Sarah, please, for the land acknowledgement.
Yes, of course. All right, so the
Right.
health unit is situated on lands.
Speakers on.
Mic off?
Yeah.
Yeah. Fair enough. Okay, thank you. The health unit is situated on lands that are the traditional territories the Anishinaabe people who continue to live, work, and play throughout these territories, including in urban communities. I encourage everyone to think about how they may contribute both personally and professionally to the process of reconciliation and respond to the 94 calls of action to the Truth and Reconciliation Commissions of Canada.
Thank you, Sarah. So before any other business, we will defeat elections for the chairperson and vice chair of the board. So we have a name put forward for the chairperson of the board, Rick Champagne. Sorry, for finance and prop. Great. Right. So we have Dave Wolf as the incumbent, and your name has been put forward as well for.
Has any other names been put forward?
No other names have been put forward.
And I would like to nominate Sarah Inch, if she would be interested in sitting as chair of Finance and Property Committee for this year.
Well, thank you very much. And sure, I will accept that nomination.
There you go.
And any other nominations? Okay, so there's a resolution for it. Be it resolved that Sarah Inch be elected chairperson of the Finance and Property Committee for the year 2026. Can I have a mover?
Thank
you. And seconder? Thank you, Jamie. Okay, and I'll call for a vote. So Rick, any conflicts of interest to declare? I'll call for vote to Rick Champagne.
Yes.
Karen Cook is absent today. And so is Blair Flowers. Sarah Inch.
Yes.
And Jamie Lowry.
Yes.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott.
Yes.
Tim Shepard.
Yes.
Marianne Stickman.
Yes.
And Dave Wolf.
Yes.
Excellent, carried. And next is the vice chairperson of the Finance and Property Committee. The incumbent is Karen Cook, and though she isn't here today, she has agreed to have her name be put forward for this position again. Are there any other nominations? So the resolution before us, be it resolved that Karen Cook be elected vice chairperson of the Finance and Property Committee for the year 2026. Can I have a mover? Oh, actually, I guess I should be handing this over to you, Sarah.
Okay, wonderful. Thank you very much. Okay, so do I have a mover? And I'm seeing Tim Shepard, and you're going to move this. A seconder? Rick Champagne? Excellent. Okay, thank you very much. Okay, so we have a recorded vote. So we have Rick Champagne.
Yes.
Karen Cook is not here. Blair Flowers,
Not here.
not here as well. Okay. Myself, yes. Jamie Lowry,
Yep.
Jamie McGarvey.
Yes.
We also have Jamie Restuel,
Yes.
Alex Scott,
Yes.
Tim Shepard,
Yes.
Ann Strickland,
Yes.
and Dave Wolf.
Yes.
Very good. Okay, so moving on, looks like we are. Be it resolved that the Finance and Property Committee agenda dated January 28th, 2026 be approved. Can I get a mover for that, please?
There's movers online.
Jamie Restuel
I mean, McGarvey's second.
and Jamie McGarvey is the seconder. Perfect. So we'll do a vote. Rick Champagne,
Yes.
myself, yes. Jamie Lowry,
Yes.
Jamie McGarvey,
Yes.
Jamie Restuel,
Yes.
Alex Scott,
Yes.
Tim Shepard,
Yes.
Ann Stickland,
Yes.
and Dave Wolf.
Yes.
Wonderful. Okay. So moving on, we have a recommendation. Be it resolved that the minutes from the Finance and Property Committee meeting held on June 25th, 2025 be approved as presented. Can I have a mover and seconder? Okay, Dave Wolf. And a secondary, Tim Shepard. Okay, so Rick Champagne
Yes.
and myself, yes. Jamie Lowry,
Yes.
Jamie Garvey,
Yes.
Jamie Restuel,
Yes.
Alex Scott,
Yes.
Tim Shepard,
Yes.
Mary Ann Strickland,
Yes.
Dave Wolf.
Yep.
Perfect. Yes. And of course, if I've missed any of you and you have a conflict of interest, please let me know. Okay, so we have a call to order. The Finance and Property Committee members join the meeting. And so the date of the next meeting, and that needs to be determined. Business arising and new business. 9.1, operational plan and financial budget proposal 2026.
So we are presenting the budget for 2026 today for the board. And I just want to, first of all, acknowledge all of the intensive work that went in by many staff members to prepare this. You'll have seen in my MOH update to the Board of Health for this meeting that I have taken the opportunity to highlight some of the valuable programs and services provided by the health unit. I thought it timely given the increasing financial pressures that are faced by public health. Local public health contributes to the current and future health and vibrancy of communities. And with a cost benefit ratio of 10, it is a sound investment, especially when you consider for every dollar the municipalities put in, the province is contributing $3, at least over $3. And despite increasing workloads for local public health units, examples would be, the 2 new vaccines added to our seasonal vaccine campaigns, and responding to growing substance use concerns. Public health budgets have been effectively shrinking over the past decade because public health funding has not kept pace with inflation. For 2026, we're facing another year of just a 1% increase, which is again sub-inflationary, and also does not cover the increased staffing costs, which account for about 80% of the health unit budget. In response, we've reduced both operating expenses and staffing costs, as well as looking for ways to generate increased revenue. So in order to present a balanced budget, we are recommending a municipal levy increase of approximately $1.47 per capita. This will bring the municipal contribution of the shareable base to 22.7%. We also did receive one question in advance of today's meeting, but maybe Paul, I'll turn it over to you first, and then I'll come back to answer.
Okay, well, thank you, Dr. Zimbalati. I think some of the things I'm going to say are repetitive to what Dr. Zimbalati had said, but I think it's worth saying again. I do want to recognize the efforts the entire team put into creating this operational plan and financial budget proposal. As you can imagine, there's much complexity considering the multiple funding sources that we're dealing with, whether they be shared or 100% funded. We attempted to provide enough detail to be as transparent as possible. The 2026 financial plan includes the last of the 3-year stretch of 1% year-over-year ministry portion funding increases. And the cost share split is 77.29% ministry and 22.72% municipal. As Dr. Zimbalati mentioned, the 1% annual increases have not kept pace with inflation of operational costs such as wages and benefits, utilities, IT licenses, insurance, and audit fees as examples. Throughout this 3-year time frame, reduction in programs and personnel were necessary and continues for 2026 to address the ongoing funding shortfall. The following are some examples of actions the health unit took to close the funding gap. We did FTE reallocations, reductions through reorganization. We reduced non-salary operating expenses across all programs and departments. We introduced a vacancy factor into the budget process. We also introduced technology use to improve efficiencies and reduce FTE efforts. For example, bulk testing, combining phone with Teams, and new performance management process. We also, as Dr. Zimbalati mentioned, we're increasing revenue. The largest component in the plan of this is from fees charged to the federal Canadian Dental Care Program. So 80% of our health unit costs are wages and benefits. Therefore, our main cost pressures year over year are pay increases. Collective agreements for ONA and OPSU expired April 1st, 2025. The health unit negotiated with each union, as well as with the non-union management group, resulting in a wage increase of 3.75 in 2025 and 3.25 in 2026. The next round of negotiations will begin in 2027. And unfortunately, as of now, in 2027, the ministry funding is currently unknown and not anticipated to be shared until much later this year. So with the wages having to be renegotiated, not knowing our funding. We really don't know where we're going to be going at 2027. So we do anticipate a municipal reserve balance of $2,488,411. But that's only 10% of our total annual costs. Not knowing future funding or wages in 2027, we propose to not use any reserves in 2026. They should only be used for any future one-time cost pressures when known. We need to continue to take steps to prepare for uncertainty and hope for the best in 2027 and beyond. So in summary, we're hoping for your support of our 2026 proposed financial plan that includes a 4% municipal levy increase, resulting in a per capita levy year-over-year increase of $1.47. Welcome any questions.
Rick Champagne has a question.
Mostly a question, it's a comment. I just come back from Roma conference and Jamie McGarvey and Jimmy Ristow were both there. And when the minister did her announcements for long-term care, acute care, nothing was mentioned about public health. And that's disheartening and say the least, because we're the front line when things happen. And it's disheartening that they're not coming to the table. So hopefully at Alpha, something could be done or said, maybe through Alpha, because some questions were asked at the mic and no straight answer was given. Why public health is a shortfall, especially us for this year. We're short because, and it's staffing, like you said. And to go into the reserves, it doesn't help us in the long run. What's going to happen next year or what's going to happen further down the line. We all know how much we need for reserve to keep the doors open and keep the staff free. So I'm in favor of it. Any other comments?
Are there any other comments around the room? Jamie Lowry?
Yeah, similarly at our council meeting, we advised that the council, that Sarah and I, that because of those pressures you're mentioning, that they're likely, although we hadn't approved the budget, but there's certainly down pressure from the province to the health unit. So I think that they're aware that there's going to be some changes in the levy. So thank you.
Any other comments? Okay, seeing none. So we are moving forward and looks like we're at insurance program annual report.
You have to do a motion.
Oh, we have to do motion. Okay.
And there was a question that came through online that maybe I'll just address. It wasn't directly related to the proposed budget, but I think it's relevant and it related to understanding which of the programs and services the health unit offers that are mandated versus non-mandated. And it's actually a really, it's a tough one to, answer in black and white terms. For clinical services, I would say that it's relatively clear as to the mandate under the OPHS for a clinical program. So there is some flexibility written into the OPHS in terms of how we facilitate, for example, access to sexual health services for priority populations. But with non-clinical programs, it's less clear, especially when it comes to health promotion. The new OPHS that we're moving toward indicates that the Board of Health shall use a process to identify local priorities, develop and implement appropriate comprehensive health promotion strategies based on those local priorities for social, natural, and or built environments. So that leaves a lot of flexibility for public health units to identify local needs, local priorities in collaboration with partners, based on need, based on capacity, based on respective areas of influence and expertise. So with this flexibility built in, it's really hard to put our programs, many of them that really all all programs should have a health promotion component to them. So it's really hard to put them into one basket or another of mandated versus non-mandated.
Thank you very much for that answer, and I hope that clarifies that question for the individual who asked. So. Resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Parry Sound District Health Unit approve the 2026 Board of Health Public Health budget as presented. And I need a mover. Rick is moving. The seconder, please.
Sure.
And David Wolf. Okay. And right. So Rick.
Yes.
Oh, yes. Jamie Lowry.
Yes.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott.
Yes.
Tim Shepard.
Yes.
Marianne Stickland.
Yes.
And Dave Wolf.
Yep.
Hello. Yeah, excellent. Okay. And it's carried. Very good. So we are moving on to, we are going into in camera. So
There's no in camera component, is there?
is there an in camera component? All right. Very good. So move forward. We're not
It's
doing
adjourned.
that. Are we adjourning?
You see one.
Wonderful. This is a very productive meeting. All right. So I guess that I'm moving to adjourn. And do I need a mover and seconder for that?
We don't need all the rest.
No. Excellent. All right. Thank you very much.
Great. So thank you. Louise, Shannon, Chris. Does anyone need a brief pause? Grab a sandwich before we move on.
Constitutes brief.
So I will call the Board of Health meeting to order at 5:27 p.m. The first order of business, item 2.0 is elections, and 2.1 is election of the chairperson. We do have a nomination of Rick Champagne. And are there any other nominations?
I'd like to nominate Jamie Lowry.
I appreciate it, but I don't think I will. I'll let Rick stand as the chair. But thank you, sir.
All right, so the resolution be it resolved that Rick Champagne be elected chairperson of the Board of Health for the year 2026, moved by. Thank you, Jamie Restool. And seconded by Jamie McGarvey. Thank you. And recorded vote, Rick Champagne.
Yes.
Aaron Cook is not here. Blair Flowers.
Accept.
If you'd said no.
Sarah Inch.
Yes.
Jamie Lowry. Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott.
Yes.
Tim Shepard.
Yes.
Marianne Stickland.
Yes.
Dave Wolf.
Yep.
Thank you. Carried.
All right, thank you for the confidence. And next order is vice chair. We have right now, we have two people, Jamie Larry, and Sarah Inch. We'll start with Jamie.
I'm not interested.
Interested? Sarah Inch?
Of course, I would be interested. I believe in public health. I love public health, and I think this group has gotten North Bay to a place where many other communities are envious of us. So if there's no one else who wants to do it, then I would do it.
Is there any other nominations? Seeing none? Sarah Inch, you need a mover and seconder, please. Moved by Jamie Larry and Mr. Dave Wolf. Rick Champagne, yes. Sarah Inch,
Yes.
Jamie Larry,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland,
Yes.
Dave Wolf,
Yes.
carried. Thank you, Sarah.
I just want to thank those who are willing to put their names forward and let them stand for the positions of vice chair of both the finance and property and board of health. I really appreciate the effort that goes into that.
Okay. Let me sit here. Oh, it's just Paul. Okay. Well, I call the meeting into order. We're up to approval of agenda, I guess.
Yeah.
This is all, okay. 3.0, approval of the agenda. Need a mover and a seconder, please. Tim Shepherd. And Sarah Inch. Be resolved that the Board of Health agenda dated January 28, 26 be approved. Rick Champagne, yes. Sarah Inch,
Yes.
Jamie Larry,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland,
Yes.
Dave Wolf. Carried. Any conflict of interest? If something does come up, if you see something comes up in later, let us know. Approval of the previous minutes, 5.1, Board of Health minutes of November 26, 2025. Need a mover and seconder. Moved by Dave Wolf
Jamie McGarvey.
and Jamie McGarvey, second. Did resolve that in-camera minutes from the Board of Health meeting held on November 26, 2025 be approved as presented. Any discussion on the motion?
Just a point of clarification. In the minutes, we show Chris Bowe's name several times doubled up in a couple of places. I don't know if that's a problem for the minutes or not. It does indicate that there may have been two individuals with the same name at that meeting as a staff member. I don't know if you want a friendly amendment. We don't have to change the minutes, just a friendly amendment, just a note, please, if we could.
Thank you. Anybody else have discussion on the motion? If not? Rick Champagne, yes. Sarah Inch,
Yes.
Jamie Larry,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland, Dave Wolf.
Yes.
Yes.
Carried. Next item is 5.2 Board of Health in camera minutes from November 26, 2025. We don't have any, there's no discussion on the motion anyway. We're just going to pass them, right? So I need a mover and a seconder, please. Dave Wolf
Maybe rest.
and Jamie Restool. Rick Champagne, yes. Sarah Inch,
Yes.
Amy Lowry,
Yes.
Amy McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Mary Ann Stickland,
yes,
Dave Wolf.
Yes.
Great. Next item, date of the next meeting, 26 meeting schedule of notice. I believe there.
I'll just note that the schedule does deviate from the usual pattern because of the municipal elections in the fall. But the bylaws do require 6 meetings a year, so that's the reason for an October meeting.
Just doing a little housekeeping. Need a mover. I'll go with Mary Ann Stickland,
sure, thanks.
Alex Scott,
Yes.
any discussion on this motion? The dates are all good. Okay. Rick Champagne, yes. Sarah Inch,
Yes.
Amy Lowry,
Yes.
Amy McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Mary Ann Stickland,
Yes,
Dave Wolf.
Yep.
Carried. 7.0, appointment of standing committees for 2026. It be resolved that the Board of Health of North Bay Parish Sound District Health Unit approves the appointments of the following boards of health standing committee for 2026. Finance and Property Committee, comprised of all board members, deal with matters of finance, banking, insurance, property, financial policies of Board of Health. And number 2, Personnel and Policy Labor Employee Relation Committee, comprised of all board members to deal with matters related to the collective agreement, unions, and employment policies, non-union, and the personnel policies of the Board of Health. Need a mover and a seconder, please. Amy Lowry. Second,
Jamie McGarvey.
Jamie McGarvey. No discussions on this motion? Rick Champagne, yes. Sarah Inch,
Yes.
Amy Lowry, Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Tim Shepherd,
Yes.
Mary Ann Stickland,
yes,
Dave Wolf. Appointment of signing officers, 8.0. Be resolved that the Board of Health of North Bay Parish Sound Health Unit approve the signing officers for 2026 as follows. Board of Health Chair, myself, I'll just write these names in, right? Okay. Sarah Inch. I'll just put your name in as vice person. Medical Officer, Executive Director, Chris Bowes. Executive Director of Community Services, Louise Gagne. Manager of Finance, Kimberly Gervais. Executive Director of Clinical Services, Shannon Mantha. Executive Director of Corporate Services and Privacy Officer, Paul Massanet. Massacott. Let's see, Masson, sorry, Paul.
I'll see.
Take that, Eck. All right, no discussion on this motion? Okay, Rick Champagne, yes? Oh, it's sorry, I do apologize. Need a mover and a seconder. Jim Shepherd, move.
Yeah.
Need a seconder?
Yeah.
Alex Scott. Thank you. So Rick Champagne, yes. Sarah Inch,
Yes.
Jamie Laurie, Jimmy McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Jim Shepherd,
Yes.
Mary Ann Stickland,
Yes.
Dave Wolf.
Yep.
Okay. 9.0, appointment of legal advisor. A mover and a seconder, please. Jamie Larry. Oh, you got a conflict?
Conflict, yeah.
Okay.
Well, Lucenti, one of the partners in Lucenti Orlando is a cousin, so I'd like to.
Okay. Sheet? No, okay. Just noted. Okay, let's write it down. Yeah. Mover and seconder. Jamie Restool. Mover. Need a seconder?
I'll do it.
Tim Shepherd. It be resolved, the Board of Health of North Bay Sound District Health Unit approve the appointment of the following legal advisors for 2026. Corporate Legal Corporation of City North Bay, Lucenti and Orlando Professional Corporation, Enforcement for Legal Advisor, Joseph Kennedy, the Corporation of the City of North Bay, Health and Protection and Promotion, Joseph Kennedy, Larmer Jackson, Labor Relations for Legal Advisor, Fielding Wakely, Orup and Angelini. That's really telling them to me. And furthermore, the resolve that the North Bay Parish Sound Health Unit may use additional legal advisors as directed by the Medical Officer of Health, Executive Officer, and approved by resolution at the next regular board meeting. Any discussions on this? And I noted that Jamie Laurie is a conflict.
So just a quick question. When is it ever discussed that the legal professionals that we use are reviewed? Do we have how does that come about? Do we do an RFP for this? I mean, is it like auditing? I think I asked this question like early on, but I can't remember what the answer is. And maybe there's a really good answer. I just can't recall.
So to answer your question, no, there isn't an RFP. Generally, we research to make sure that these are still legal firms in good standing and the information's accurate. But I think it is something that we are looking into in the future in terms of being able to have a wider breadth of legal representation depending on needs and skills and areas of expertise. I think we're actually it's not common to have the Board of Health pre-approve legal advisors. Many other health units where I've spoken to, they treat it as other types of contractors. So as you would hire an engineer or, that sort of thing. So it is something that we want to perhaps review for
Next year.
the future. Yeah.
So that will be something that will come to the board as a change of policy.
Right now, it's written into the bylaws that the Board of Health approves it, so it would come to Board of Health in order to change the process.
Thank you.
Yeah, and that's the reason why we came back, because we didn't think it needed to come here in this way to allow us flexibility.
Yeah.
We will be changing it, but to change it, we have to come back here.
Yeah, like unless it's something that's relative to governance, I don't really care who you use for legal counsel. I really don't. That's an operational matter. That's your decision, not my decision. And the fact that we approve this every year has always struck me to be a bit odd. If it's a matter of governance, if it has to come to this table, then 100%, I think we need to look at how we, from a policy perspective and process perspective, how we prosecute that. But I've always wondered about that. And I think you answered this early on. And again, I apologize because I think I answered asked this question a couple of years ago, but I couldn't remember the response. So I appreciate you doing that. Thank you.
And that's why we had the conversation as well.
Yeah.
Because a lot of this is relationship based on, like, when we did the building,
Yeah.
we used somebody and that's confidence, right? So we'd continue, but why have come here? Because we might need it for a different reason, different expertise. So Dr. Zimbalati and I did talk about it, but because it's in our current way of operating, we kept it here. But we're definitely going to look at changing.
Okay, so that will come forward to us later in the year in all likelihood, so we don't have to dispense with this again in 2027.
That's the plan, is to update.
Perfect. One less thing to worry about. Thank you.
Any other discussion on the motion?
Thank you, Chair.
See none? Okay. Call the vote. Rick Champagne, yes. Sarah Inch,
Yes.
Amy McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott,
Yes.
Jim Shepherd,
Yes.
Marianne Stickland,
Yes.
Dave Wolf.
Yes.
Report of the Medical Officer of Health. Is this a miss one? Oh, geez, I scratched it out already. Oh, no. All right, business arising, vaccine refrigerator procurement and disposal.
There was a question at the last Board of Health
That was
meeting.
my,
so we-
I was gonna say, that was my question, and I think I posted to Paul, and I just wanted to say thank you for clarifying. So there are no manufacturers in Canada that provide that? Really, eh? Wow, that seems strange to me, but we're happy with that answers my question. Makes me happy anyways to know what the status of it is.
If I could respond through the chair.
Yeah, so what was the question that you
The
asked?
question was whether or not there were vaccine, refrigerator, or freezer manufacturers in Canada that we could use rather than procuring from a US-based provider. And I think the response at the time was we anticipated that the answer was no, but it was a takeaway that Mr. Massicott generously agreed to find the answer to, and I appreciate that you and Rick were able to do that for me.
I don't have any other comment.
Other comments? Okay. All right, move on to the Medical Officer of Health report, please.
So as I mentioned earlier, I did take the opportunity in this report just to speak about the value of public health. I think these are messages that we need to say over and over again to various parties. And so I do know that there was a recent delegation of Alpha at the Roma conference, and they are also planning to attend the meeting in, is it August in Ottawa? For the municipalities, Ontario Municipalities Association. So I just wanted to highlight the value of public health in this report. And if there are any questions on that content or other content within the report, be happy to.
Good.
Wolf?
The increase in Lyme disease, that's a shockingly high number when you see what it was for more than a decade, I guess, relatively speaking, and what we're seeing in a 1-year increase for our area alone.
Tick.
I'm
It
sorry.
really was an uptake, yes.
Oh,
Is that because we're doing more monitoring? Is it because there are more people coming forward to say that they had that there's been an incident? I want to get a sense of why that seems to me like a fairly significant increase.
Yeah, and we have been anticipating an increase. We'll see if it's quite that high, you know, if 2025 was more of a blip or we see a kind of continuing upward trend, but we do expect it to continue to rise as with climate change and the increasing territory that black-legged ticks are inhabiting. In terms of you know, the numbers of actual cases, Lyme disease is reportable to public health. So there could have been some underreporting earlier, but typically the testing would go through Public Health Ontario lab and we're automatically notified of those. So I do think to a great extent it represents a real increase.
That's worrying. On page 10 of 15, in the seasonal vaccines, in your report on seasonal vaccines, you say in January 2025, seasonal vaccines will continue to be available by appointment. Did you mean 2026?
Oh, yes.
Okay, just wanted to verify that I wasn't misreading that. I think that might be all, Chair. Thank you. I do have one question for you after, if I may.
Right, any other questions?
Yeah, I have a follow-up to the Lyme disease one. What work's being done with the emergency room and pharmacists in order to make sure that they are reported properly?
So, like I said, when a physician initiates testing for Lyme disease, that's sent to the lab and we get direct reporting typically from there. Yes, there is also responsibility of physician to report, but typically we would already have that. So it's not specific to like pharmacies wouldn't be reporting to us because they're not the ones diagnosing.
But they can still dispense doxycycline
They can't.
with the suspicion of a tick bite.
I don't know if that's within their scope currently.
I've had Lyme disease.
Okay,
So
they wouldn't be required to report it unless it was.
it could still be underreported.
Oh, well, we don't know of how many people have a tick bite. Definitely the number of people with a tick bite is far higher than the number of people with Lyme disease. So we wouldn't want that. We would encourage people who had a tick bite to seek testing.
Other questions for Dr. Zimbalati? I see none. Thank you very much for the report. 12.0 Board Committee Report, Finance and Property Committee. Need a mover and a seconder, please. Tim Shepherd.
Sarah.
Yep, Sarah Inch. I put you as a mover first, okay? It's your
Here.
Did it be resolved that the recommendation of the Finance and Property Committee of the Board of Health for the North Bay Parry Sound District Unit approve the 2026 Board of Health Public Health budget as presented? Any discussions, other discussions on this motion? I see none. I'll call for the vote. Rick Champagne, yes. Sarah Inch.
Yes.
Jamie Laurie.
Yes.
Jimmy McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott. Tim Shepherd.
Yes.
Marianne Stickland.
Yes.
Dave Wolf.
Yes.
Carried. .1 Corporate Sponsorship and Donation 2025 Report. This one? Oh, sorry. Correspondence is included in your package. Just got to bring up, okay. We'll move on to 14. 14.1 Corporate Sponsorship and Donations 2025 Report. Okay, no discussion on this one? Okay. 14.2, request for proposal 2025 report. See none. 14.3, Association of Local Public Health Alpha 2026 Winter Symposium registration. Does anybody want to go to it? Sarah Inch?
Well, I can say that I've been to many and they're very worthwhile. And I encourage anyone around the table or online to participate.
We have to register for this, so just to make sure whoever puts their name forward, more people are going to go. So right now, do we have anybody who wants to go? And if you do go, make sure that you say you're going. I'll put a number. I'll put 2 down for now, just in case somebody decides to change their name or put their name forward. Does that sound fair? All right, I need a mover and a seconder, please. Alex Scott. Jamie Restool. Move by Alex, second by Jamie. They be resolved that the Board of Health and Northern Parry Sound Health Unit authorize 2 board members to attend the Association of Local Public Health Agency Alpha 2026 Winter Symposium to be held virtually on February 11th to the 13th, 2026. And furthermore, it be resolved the expense related to attendance at the Alpha 2026 Symposium be paid in accordance with the Public Health Bylaw Section 6 and 79 remuneration, and be furthermore that the attending board members be required to provide a summary of the symposium at the Board of Health, a subsequent meeting. Now, what's the date that you have to enroll by? Is there a date?
Is the deadline?
I don't see it on here.
I can't recall, but it is fairly imminent.
Beginning of February, so you still got within another week or so to let Ashley know if you're interested or not. Okay. Any other discussion on this motion? Nope. Vote. Rick Champagne, yes. Sarah Inch. Jamie Larry.
Yes.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott. Jim Shepherd.
Yes.
Marianne Stickland.
Yes.
Dave Wolf.
Yep.
Carried. 14.4 Quality Issue Report 2025 report to the board. I need a drink of water. Need a mover and a seconder, please? There's no motion. What's this motion for? Okay. Oh, another page. There it is. Sorry. 14.5 Food and Housing Affordability Presentation. Aaron is here. There's Aaron. Aaron Reese.
Perfect.
Health Promotion Specialist from Foundational Services. Thank you for coming, Aaron. The floor is yours.
Great. Thank you for having me. It's great to be back. I was here in November providing an update on our strategic priority related to this topic. So thank you so much for having me. I'm really pleased to be back to be able to share the results of our 2025 food and housing affordability. Food affordability report. So next slide, please, Christine. Thanks. So what I'm going to share with you today is an overview of what we presented in November in terms of just the significance of poverty, homelessness, and food insecurity as important public health issues. Next, I'll provide an update about how we monitor food affordability and the inclusion of the new local housing data that we've added for 2025. And I'll share the findings of our data analysis. And lastly, some next steps and recommendations for action for the Board of Health today. I am going to be sharing a fair bit of data. I'm hoping to explain things as clearly as possible, but happy to field questions and clarify anything that doesn't seem clear. So we're working very close to this data. So anyway, so excited to hear your feedback and your thoughts. Next slide. So as you know, we have incorporated a strategy within our strategic priorities focused on refining our role within systems level efforts to reduce poverty and homelessness. We heard loud and clear from the consultations leading up to the development of our strategic plan that these are important priorities that continue to be escalating in our communities. Income, housing, and food security are foundational social determinants of health. When any one of these factors is compromised, it can create a ripple effect that worsens health outcomes and deepens inequity. We want to ensure that poverty, homelessness, and food insecurity are well understood as important and deeply intertwined public health issues. We want to be continually seeking to understand the local context and situation around these issues as well. So part of how we do this is through what we call population health assessment and surveillance, which is basically monitoring, collecting, and sharing data, which we're mandated by the province to do through the Ontario Public Health Standards. And this includes monitoring food affordability. Next slide. So how we monitor food affordability has evolved over time, but it always starts with an understanding of the cost of healthy eating. So health units across the province monitor food costs at the local level using a tool called the Nutritious Food Basket Survey. This is provided to us by Health Canada and is adapted slightly from province to province to reflect different contexts. And it includes a list of foods that are consistent with Canada's food guide. So we visit 12 grocery stores across the district, including urban and rural stores, stores from each of the various parent grocery store chains, regular and discount stores using both online and in-store costing methodologies. And basically we come up with a representative cost of healthy eating according to Canada's food guide. So most of the foods on the list are what we would consider whole unprocessed foods that have to be prepared. It assumes people have the knowledge, the skills, the equipment necessary to do food preparation. So because of that, the Nutritious Food Basket is considered a very modest estimate of food costs. And it is very much that, an estimate. However, it does give us a really strong baseline of the cost of a basic nutritious diet. So in 2025, the monthly cost of eating well for a family of 4 in our health unit district was $1,260 roughly. It is important to note that neither Canada's Food Guide or the Nutritious Food Basket are inclusive for all religious and cultural groups, and they don't acknowledge traditional Indigenous foods or traditional food procurement practices. So those are limitations we do want to bring attention to. And so we have some other, so we kind of have the reference family of 4 that we rely on, but we also have the other food costs for different household scenarios there as well. But the cost of food doesn't mean much without the context of household income. So health units calculate the monthly cost of food for a variety of family and single adult households. And then we obtain average monthly rental rates within our areas, and then we review these within the context of a variety of income scenarios. So year after year, this data shows in real numbers how difficult it is to make ends meet when incomes are too low. Of all the households, those who receive social assistance, so Ontario Works or the Ontario Disability Support Program, so OW or ODSP, they experience by far the most dire financial circumstances. So I'm going to get more into that in a minute, but next I want to go over our rent data sources. So next slide. So the local rent rates we have traditionally utilized in our food affordability reporting are averages based on data collection across Canada from the Canadian Mortgage and Housing Corporation, or CMHC is the acronym. These rates are often scrutinized for appearing too low compared to current market rental rates because the CMHC data does reflect an average that includes long-standing rental units that have been more protected from high inflation and are more affordable technically. CMHC also doesn't have any data for Parry Sound, which has always been a data gap for us. The numbers are pretty consistent year to year, but 2024, we didn't have reliable data for a 3-bedroom, which is why we brought in both the 2024 and 2025 data this year to look at. And at first glance, you can see that the rates do appear low. So for example, it would be highly unlikely to find a 1-bedroom apartment for under $1,100 in North Bay, but that, again, it does reflect the average that includes the long-standing, more affordable units. Next slide. So because of the challenges we've had with using the CMHC data, just in terms of it not necessarily being representative of the housing data for someone who would be looking for new housing in real time, the foundational services team, the team that I'm on, we were supported to complete a pilot project collecting market rental data for North Bay and Parry Sound this year, or in 2025. So for 5 weeks, rent rates were gathered for the 4 different bedroom types. And we did sort of a data cleaning process where we excluded any rooms for rent that were kind of showing up in the listings we were looking at, and also units that would be considered luxury, so waterfront, cottages, rural properties with acreage and that sort of thing. So we were able to kind of cut out the outliers that might have skewed the data. So next slide, I'll show this information to you now side by side with the CMHC data. Okay.
Can I ask a quick question?
Oh, sure.
Is that inclusive of utilities, insurance, things like that, or was that just the base rent?
So it's difficult to say with rental data. What we usually say is that it may or may not include utility costs, because sometimes rents do include that, but sometimes they don't. So that is definitely a challenge. So when we put these numbers side by side, you can see how much higher the local rent rates were in 2025 that we collected compared, which are the green bars for North Bay and Parry Sound, compared to the CMHC data, which is the blue bars. And again, that's just for North Bay. But either way, it's still good to have both data sets. So we do have some hard data on local rent rates that represent more longstanding units and the estimates for somebody who would have been looking for housing in 2025. Okay, next slide. So we want to start putting a picture together on what this means for some of the most vulnerable households in our communities. A couple of other key data points that we want to consider include specific to the relevance for social assistance recipients. We know that the vast majority of folks on Ontario Works rent their homes, and very few live in rent geared to income or subsidized housing. So they're paying market rates. And from a household demographic perspective, when we're looking at putting together the income scenarios, we know that about 95% of folks on Ontario Works are single people. So whether it's single adults living alone or single parents with children in the household. Okay, next slide. So here we're looking at the shelter amounts that social assistance recipients receive. So when you are on social assistance, you get a shelter allowance and a basic allowance for your other expenses, which are made up of those together make up the total amount you would receive monthly. So here we want to demonstrate how mismatched the shelter allowances that folks on social assistance receive, how much lower they are than the CMHC data, but also the much lower than the local data that we collected in 2025. So this gives us some real numbers on the fact that social assistance rates don't reflect the cost of living. Based on the way that the policies are in place as well, if somebody doesn't have a fixed address who's on these programs, technically they're supposed to lose their shelter allowance because they're not paying rent. Anecdotally, I've heard that the caseworkers supporting clients work really hard to, support these folks in different ways to make sure that doesn't happen, but it definitely does happen. Next slide. So that's specific to a bachelor apartment for a single person. The next slide shows a 3-bedroom apartment for a single parent with 2 children, a boy and a girl, and the boy's a teenager. So, and the apartments that we select for these scenarios are based on what's called the National Occupancy Standard. That's also set by the Canadian Mortgage and Housing Corporation, which reflects the number of bedrooms that would be required in a unit that would be appropriate for the family size. So, of course, it based on how unaffordable apartments can be, it's very likely that a household like this would find themselves in a unit that doesn't meet their needs. So maybe a 1 or a 2-bedroom place. But for purposes of following the national occupancy standard, we do use the 3-bedroom apartment in this scenario. So on paper, folks with kids in the household do receive a fair bit more income than people without kids because of the Canada Child Benefit, but it's not enough to be protective against poverty, food insecurity, and housing insecurity. So again, this is just another example of how mismatched the Ontario Works Shelter Allowance is with the real costs of rent in our area. Okay, next slide. So we have the food data, we have the rent data, and now we want to put the picture together. So, everyone feels the pinch of rising food and rent costs, but it's low-income households who can't afford to pay the difference. So we take the cost of eating well, combine that with the local rent rates, and then we subtract that from the household income to understand affordability. So this is only looking at rent and food, doesn't include any of the other costs of living. But so this first, the first chart here represents folks who would be in a long-standing apartment situation. So the CMHC data, and then click again, Christine. And then the next chart, oh, oops, I had a little, can you go back? Maybe it'll pop up. If you click, is it not showing up?
On my screen, but I don't see it.
Okay, well, you know what, just go to the next slide because the Parry Sound case demonstrates it as well. So it's similar for North Bay here, but because we don't have the data for Parry Sound, that reflects a long-standing unit, the CMHC data. We only have the local data we collected for 2025. It's a very dire financial situation for these households. They don't have enough money to make ends meet. They would be struggling significantly month to month to be troubleshooting on staying housed, let alone eating well and paying for the other costs of living. Next slide. So the data that we've put together creates a really important local picture for housing and food affordability for folks who are relying on social assistance. This is consistent with what Ontario data shows in terms of OW and ODSP rates sitting far below the poverty line. So within the red box outline here, this shows the data for Ontario for a single person. So the black line at the top of inside the red box shows where the official poverty line is. The gray line shows the deep poverty line, which is 75% of the poverty line. And then the bars below show how much lower the rates are. So how in such deep poverty from a provincial perspective. So it's very, very concerning, but consistent with what our data shows. Next slide. So again, going back to the interconnectedness of income, housing, and food, I just want to share a couple more statistics that help frame the whole picture. So we know based on the most recent homelessness count data for Nipissing that over 80% of folks report having social assistance as their main income. So this really connects the issues of, like, traditionally we've always reported this information within the context of food insecurity, but now we really want to be shining a spotlight on the connection between inadequate social assistance rates and how it connects to the homelessness crisis. The top two barriers cited that folks shared around finding housing were that rent was too high and income was too low, and that about 2/3 of people were homeless for 6 months or more, signifying that there's no easy exit from homelessness when people find themselves there. And just the importance of making sure that if homelessness does occur, that it's brief and non-reoccurring, because once somebody finds themselves in a situation of chronic homelessness, it's much more difficult to stabilize and exit homelessness after it's been sort of ongoing. From a food insecurity perspective, we know that households at higher risk are those who have income from social assistance and those that rent rather than own their homes. So again, just trying to like put all these data pieces together to help frame the full picture of the importance of income, food, and housing. Next slide. So the next steps in this work are already resourced and being planned for as part of actioning our strategic plan deliverables. So the key things we're looking at for this year are, we already have the food and housing affordability fact sheets live on our website, but we're going to have a more housing specific one for North Bay and Parry Sound that really spotlights the rental data more closely with a couple of other key data points that we want to bring in around housing. We want to be networking closely with community partners to understand how the local rent data that we've collected can be meaningfully utilized. We want to make sure the work that we're doing in the community around housing is complementary to what's already happening and how we can be working together with others who are involved in responses to homelessness. We want to be building an advocacy plan for all levels of government. This connects to the motion that we've put forward for you today. So we want to be capitalizing during policy windows and consultations to share the data that we have to make sure that it's utilized in policy decision making and that information from our community is being actively shared to inform those decisions. And lastly, a piece that we haven't really included in this work yet, but we hope to develop a strategy for in 2026 is engaging people with lived experience to make sure that we're covering any blind spots that we have in this work, and that the types of information we're sharing is relevant and really reflects the current situation. Okay, next slide. So I won't keep you any longer, but the key things we're asking for today are just for your ongoing support and principle for the efforts of staff working to monitor, raise awareness about, and working to reduce health inequities, including poverty, homelessness, and food insecurity. And more specifically, we're asking you to sign off on a letter today to raise awareness about this information with the provincial government as part of the 2026 Ontario budget consultation. We're asking for an increase to Ontario Works and ODSP rates to reflect the cost of living, and indexing Ontario Works rates to inflation. That has already happened for ODSP. That came into effect a few years ago, but it hasn't been enacted for Ontario Works. So we'd like to see that as a policy measure. So those are the priorities we're putting forward for the province to consider with regards to building into the 2026 budget. So that's all I have for you today. I'd be happy to take any questions if there are any, or comments.
Sure there is. It's too bad that nothing's going down. Everything is going up.
No.
And it's not changing.
Yeah.
That was the big thing at Roma. And everybody had the same complaint. And it's the same complaint today. It's not just here, it's everywhere.
Yes.
How you deal with it. Any other questions, please? Around the table? Can we put the screen back up again so
Yes.
we've got 2-3 other board members. Go ahead, Sarah.
Well, I just wanted to, confirm that when we talk about Ontario Works, we're talking about parents, families, children, that it's not just about, it's about investing in that generation coming up as well. to
Absolutely.
ensure that they have the basics to get success in life.
Mhm. Yeah, absolutely. We have some really good data on how much, poverty and housing insecurity, food insecurity contributes to early adversity and adverse childhood experiences. And we want to make sure that the policies we have in this province do everything they can to ensure kids in particular have a good start. So it's important for everybody, but particularly families with children in the household.
Thank you.
Yeah.
Next one I have is Jamie McGarvey.
Thank you, Mr. Chair. I just wanted to make sure that you're working, kind of stepping along with the DSABs. Because they have a lot of this information, and I'm hoping that the two organizations, well, the three, because you've got North Bay Nipissing and they've got Parry Sound District DSABs, that you are working together on that, correct?
Yes, yeah, we're relying on their data definitely for the Ontario work statistics. So we have fairly good partnerships. There's been a staff shuffle in the Nipissing at the Nipissing DSAB in the Ontario Works portfolio, but definitely relationship building, and that's a key piece we hope to do next, because we did reach out to the DSABs leading up to the data collection project to ensure that there weren't data sets that they had for local rent that we didn't have access to. And they typically use the Canadian Mortgage and Housing Corporation stats as well in Nipissing. And Parry Sound, we weren't able to identify any rent averages. So I'm excited to network with them more closely. We didn't really want to do that ahead of launching the information with the Board of Health and getting the content live. But now that everything's available and the fact sheets are ready to share, yeah, really excited to do more networking with them to understand how the information can be meaningfully utilized for planning purposes and knowledge translation in the community. And also what other data gaps exist that would be important to understand and potentially collaborate on filling.
Thank you. I think that collaboration is extremely important.
Yeah,
I know I'm
absolutely.
on the Parry Sound DSAB, and a lot of what you've presented today is things that we're talking about as well. So
Yeah.
Thank you.
Chris Bowes, my executive director, and I earlier today participated in the Parry Sound DSAB consultation for the updated housing and homelessness plan. So there were some really great conversations there, and we look forward to seeing what comes out for the new plan there. Thanks.
Jimmy Lowry.
I just find that statistic of 82% of people, because we, as a community, we tend to think that the homeless situation is purely based on addictions and schizophrenia and all these other things. And really, there's clearly a gap between matching, what people need and what's available. So it's a great statistic, because we're really hot to trot about, these temporary services and these kinds of things. But really, the answer is, from when I look, is matching those things between income and affordability when it comes to particularly housing. So
at a minimum,
yeah.
Right?
Because it's just interesting.
It's not the only solution required, but it certainly is an important piece of the picture.
Right.
It provides very concrete data around that. And you're right. I think it helps break down myths about what the solutions need to be and who the problem is,
Right.
what the problem is.
Right.
But yeah, it's hard. There's such a complex.
Well, it's a complex population too.
Yes,
there is some of that in there.
Of course, yes.
But the bias in the community often is skewed towards, well, these people are, they're drug addicts, or this, they have it, and really not taking the heat off the provincial government when it comes to OW and getting these people, facilitating them getting back on their feet and secure food security and those kind of things.
Mm-hmm, mm-hmm. Yeah, thanks for those comments. Yeah.
That's Sarah next.
So I just wanted to thank you for bringing to our attention the difference between the CMHC projected rents and what the actual findings from your research shows, because there's quite a significant difference.
Yes.
You know, it's unfortunate that the province is using data that may not reflect local realities. So.
Yeah, and it's something we want to like we framed it as a pilot project, but I think it has a really important utility in the community to understand the full picture. So we have some more kind of background work to do on if we're going to continue with this year to year. That's not clear yet if it's going to be a need, but I think the networking with partners will help figure out where else it can be used and if it's something that we want to keep prioritizing. Yeah, thanks.
Thank you.
Next one, I have Jamie Restool.
Thank you, Mr. Chair. I was going to put my hand up earlier, but I thought 3 Jamies in a row would probably be 3 strikes are out. So let someone else go first. Just a couple of points. Just wondering if it's possible. I don't know if we have the data, but I appreciate everything that was presented. Great to see the difference in the rental information year over year. I know one of your earlier slides had food costs as well for 2025. I don't know if it's possible to incorporate some of those increases. We know they're increasing, but it's always interesting to be able to see the information, in one space when we see the increase year over year. The other comment is on the expansion into meeting with those with lived experience. I think it's always important to see that perspective because and I say this with all respect, no disrespect at all, but we see data and we see numbers and we see, and I think this goes a little bit to some of Jamie's comments earlier, where there's, within the community, there's some thoughts around the homelessness issue and that type stuff. But if we get the opportunity to really engage with those who are involved in this or affected by this, it gives a little bit different perspective. And I think it helps us in determining and developing strategies to move forward where there's more voices at the table and there's an opportunity for those affected by this to share their thoughts on it as well. So appreciate looking at that for 2026. And then the last piece is just when we talk, I agree with the requested advocacy asks with letters. And again, going back to our chair's comments earlier about being in Toronto, last week and hearing the challenges across the province, but also acknowledging that the province needs to take a little bit more leadership in this in terms of the costs associated with the issue. And we all know, sitting around our council tables and sitting around this table, that a lot of these things are being downloaded to us as municipalities and cities to cover the cost in, where there should be more, I believe, a provincial input or provincial, they need a little bit more, they need to be at the table a little bit more in terms of supports and funding and helping to implement some of these strategies that we're developing. And it shouldn't sit just at our health unit table and at our council tables to fund the efforts that are needed. I'm really using up probably about 3 months of time here because I don't usually speak too much. So please indulge me. I have 2 other comments and I just forgot one of them. But one of them that I just wanted to add is I appreciate the information, the data for North Bay and Parry Sound. But being a representative from West Nipissing, it would be great to see some of that information, especially when it comes to the housing market and the rents and that type information. We do live in a little bit different part of the district, and it would be helpful. And especially if we're looking at advocacy, I know data is always important, and the more voices that we can bring from our respective communities to the issue, it would be helpful and appreciated from that perspective. And I just mentioned that because we just went through the budget exercise and we talk about municipal apportionments that we're putting forward to support the health unit. And I know, going back to my table, if my council table, if we see North Bay and Parry Sound, and that's fantastic, I'm going to be asked where's West Nipissing's information in this whole process as well. So if I can friendly ask if there can be some data that's put together. I know there's a lot of work that goes into it. But that would be great. And I'm not going to use all my time or my overtime because I forgot the fifth point that I wanted to make. But I always appreciate listening to. It's part of my learning process is to hear those around the table. So really want to say thanks to those who've shared on this issue and other issues tonight. Thank you.
Thank you, Jamie, for your comments. Anybody else? Go ahead.
What are Alex?
Alex. Call you Scott. Alex.
Thanks, Ray. You mentioned around the healthy eating behaviors, probably a little harder to quantify, what that gap looks like. Is there a perceived gap, and are there community partners that we can leverage to help solve that gap?
In terms of food insecurity rates or
Food preparation rates. You mentioned the difference between, the healthy eating and processed foods.
Yes. Okay. You bring up an interesting point. So let me just think about how to reply. Actually, I didn't include any stats about household food insecurity, but the rates are very high for our area. It's about 1 in 4 households that live with some degree of what we call food insecurity, which means not having enough money for food. Now, food insecurity isn't necessarily a measure of diet quality, which is really interesting to kind of think about the difference. And then in terms of we want to be careful with how we frame solutions to the problems that we're presenting. So for example, what we know about, for example, food preparation and food skills that people have, it's pretty similar across all income levels. And if anything, lower income folks typically have higher food skills out of necessity to be more resourceful with making do with less and doing more food preparation at home. But there's nothing to say. And so, of course, the skill development for folks that have limited budgets is critical. They have to know how to do more with less out of necessity. Do we want to put our efforts there in terms of an intervention to address the issues of food insecurity, or we have to be careful with how we frame that? And because when we look at individualistic approaches like that, and we do have some programs like that. For example, our Healthy Families team runs skill development program for high-risk families out of our teaching kitchen. Which is great, but the impact is so low because you can only have so many people at once coming to a session. So the skill development is great, but it might only be 6 to 8 families who are coming to get that. So all that to say, it's the food skill development is still really important and does connect to diet quality. But we want to be careful about how we match that with solutions to poverty and food insecurity.
Thank you.
Yeah.
I appreciate the report, and I repeat, specifically in terms of having local data that's relative to the realities that we face here. I would have, for future reports, I'd like to see some comparisons to other districts and the provincial context as well, because it only isolates. I realize we're looking at to bolster solutions locally, but my concern, I'm not unsympathetic. It sounds like I'm being unsympathetic. I'm not unsympathetic. My concern is that we are limited in our capacity to implement real change. We did pass a budget earlier tonight. We all agreed we're getting a 1% increase from the province of Ontario. So we're limited in what we can do.
Yeah, for sure.
So I want to temper, if I can, without being cold to the situation. My concern is that when we say things like we want to, and I'm all for advocacy. It's part of our responsibility as Board of Health. I want to be careful though how we word what we word when we suggest in the strongest ways possible to more senior levels of government that they should be doing more.
Yep.
as they should be in this context, that we're not trying to solve one problem while creating additional problems. For example, we have an aging population. We feel that specifically in this region.
Yeah.
Many of those folks are on pension plans. Many of them have already indicated in many ways that they're suffering as well. Adding an additional tax burden to other families to solve for a problem that we have here becomes another problem that we then have to solve for, if that makes sense.
Yeah.
So I just want to be careful. I support what you brought forward without reservation. But I do want to be careful in the wording that we're not seeming to overstep in one area, and that we are encouraging our friends at the province and the federal levels of government that they should be and could be doing more. Part of the issue is availability as well. So we're not building enough capacity into the system. We haven't really dealt with that. We haven't spoken to that. So there are other, affordability is a problem across the board. It's not a problem just for those who are on assistance.
Yep.
It's a problem for all families.
Mhm.
I don't care how much money you make. Affordability is an issue. So I just want to be careful that we're not diminishing in any respect to any other demographic in any way, that we're identifying, that we understand that the problem is complex,
Mhm.
but the complexity is broader than I think what we're identifying just in the report tonight. No disrespect.
And I don't disagree. And it kind of connects to what Jamie was saying, like the issues, you're absolutely right in terms of the affordability, like lack of affordable housing across the housing continuum continues to be an ongoing tension, right? We need to be doing more. We need to be funding more and getting more units available. One thing I'm not hearing a lot about in the community is advocacy around more rent geared to income housing. But I don't want to go there without networking closely with community partners that are responsible for that. And
So
what
DSAP becomes very important.
Of course, yeah.
Jamie McGarvey's comment.
Absolutely.
DSAP becomes very important in that regard, correct? But also there are other partners available to us.
Yep.
Candor College, Nipissing University, for example. In an attempt to build additional capacity for international students that are no longer coming, there have been additional residential units available through Candor, right? So we see that some progress is being made. And again, I just want to, I'm not throwing cold water on this. I just want to be careful that we're identifying all of the silos that we can, that we're not working at cross purposes, again, to Mr. McGarvey's comment, that we're not working at cross purposes, that we're working collaboratively to get to the solutions that we really want to see that'll have positive impacts in the community.
For sure. And I think like the piece around, you can be in an affordable housing unit and still be living in poverty and having food insecurity, but having secure housing, right? So I think the call for increased social assistance rates is important and dire. And if it's helpful, maybe in the letter with the correspondence, we can build in some language around what you're trying to get at. Like, we acknowledge that these issues are complex. This isn't going to solve everything, but based on what the local data is showing, there's no way these households can make ends meet, right? So, what I would love to see with the community partner networking this year is more meaningful collaborative advocacy, where it's a bunch of groups saying the same thing, calling for, whether it's more supportive housing across the housing continuum for certain populations, like, whatever the priorities are that are determined by our partners. I'd like to go there because I think that it's helpful to understand all the important pieces that will make life better for people, but it's a bit of a beast to pull that together and have that outlined really nicely.
Right.
But in the meantime, this is one piece that feels very actionable that we can be calling for based on what our data shows.
Yeah, and I don't disagree. It's carrot and the stick,
Yeah, sure.
right?
Yeah.
So we're asking for something, but we have to also acknowledge that all levels of government are dealing with the same problem,
Yes.
right? So we have to acknowledge where where progress has been made. We maybe not feel it yet in our district. I appreciate that. But we have to acknowledge that some efforts are being made. They're not going far enough, perhaps.
Mhm.
We can all argue our own perspective on those things, but I just wanted to be, want us to be careful that we're just progressing in the most positive way that we can, because we can all, there's lots of blame to go around. Jamie mentioned, we sometimes think of a lack of housing and homelessness as people that are, have addictions or mental illness issues. So that's maybe the face of what people think of when we talk about homelessness, but we've been talking about underhoused individuals and families for a long time in this district, going back many, many years. For example, not enough bedroom units for families.
Yep.
Now we have a problem that we don't have enough single units for retirees and our aging population. So on balance, we have to look at how we solve for a number of things.
It's true.
For the longer term, right? So I just want to be careful. I'm fully supportive of the report. I absolutely love the fact that you brought data that is reflective of our local reality. That's incredibly important so that we understand better what we're actually dealing with, not what statistically we might see nationally.
Yeah.
But I do just want to be careful that the wording that we're using is really reflective of what we think we need, number one, and what we think we can get, number two.
Yeah, fair.
Thank you for the presentation. I appreciate it. Thank you, Chair.
Just a second, just to echo, and I'll get with you, Jamie, just to echo what that happened at Roma. They were talking about that the other day, that more funding is going to go through the DSAPs for more homes, better homes, faster homes, try to fix the problem. And case in point, I don't do groceries that often. And I was there was the day before yesterday, and I've never seen this before until I actually followed a gentleman getting his groceries. And he was going along, he was fairly slow, but he didn't have that much material or that many groceries. So as I was going through, I could have changed lines. So I want to see what he's doing. So I went through the process. He actually returned 3 items when he got to the end because it got to be more than what he could spend. So I didn't say too much, and he left. And I said to the lady, a cashier, I said, this happened often. She grabbed the items and she walked over to a cart and it was half full. She said, we fill 2 of those a day. People are returning because they're past the budget.
Well, and the shopping the sales doesn't really fly anymore because if you go to shop the sales, it's all sold out. That's what I'm saying too. Yeah.
Sorry, Jamie McGarvey.
That's okay. Thanks, Mr. Chair. 2 things. One, I think in the covering letter, we need to make sure that it spells out to the municipalities and everyone, especially the municipalities that we're looking for support, so they can have resolutions of supporting what we're putting out here. And the second is that AMO should be included on that list of sending the resolution to. I think that would be really important.
You think Phenom also?
Oh, absolutely, Phenom.
Yep.
Yep, Phenom.
Thank you for that feedback, Jamie. A couple of years ago, when we sent out correspondence to the municipalities, we included a tailored motion that municipalities could take forward and pass themselves in support of the correspondence that we shared. So maybe we can do something similar. So it's easy for them to kind of take it and use it. And the support at that time, that would have been with, I think, the 2022 data. There was a lot of support even back then. I suspect there'd be a lot of support again.
That would be a really good thing to do. Thank you.
Okay.
Yeah.
Thank you.
Are all boards of health passing similar motions?
It's variable with regards to how each health unit tackles advocacy. in my opinion, we are quite progressive, and it's amazing to have the support from our leadership and the Board of Health that we've had in the past to bring evidence-informed recommendations to different levels of government. So it's a mix. Some yes, and some you won't hear advocacy from.
So, sorry, and I didn't read the distribution list, but are we sharing this with all the other boards of health?
Yes. Yes.
Do we anticipate that other boards of health will also put forward similar motions?
I do anticipate that.
Okay, because I don't want this to be a toothless tiger, right? There's safety in numbers, just so to speak. If we're all saying the same things, singing from the same hymnal, it has more broader appeal, which I think is to Mr. McGarvey's point that, you know, if we have municipal associations and others that are barking for us, then we need to all be doing this. Otherwise, again, I'm happy to support it, but I just want to make sure that you're going to get maximum impact if everyone across the province is, I think, pushing for the same resolutions.
Yes, absolutely. And it is a common call to action because particularly Ontario Works hasn't seen any increases since 2018. So there is ongoing advocacy. Will we see motions specifically attached to this year's food affordability reporting? Some yes, some maybe not. We have in the past, I think it was in 2023 and 2024, we had Alpha, our provincial body, put forward a motion to the province, which is great because that's our collective, right? So we're not alone. I couldn't tell you how many, though, are putting forward similar motions.
Is it possible to canvass our colleagues?
There's a COMO listserv, so the Council of Ontario Medical Officers of Health, where we can distribute resolutions so that they can also be picked up on. Now they do go to all of the other boards of health, and so all medical officers of health will see them through that way, but more directly there could be. We could include. Yeah.
Thank you.
Anybody else have any questions for Chris? Or for Aaron, I mean? Nothing? Thank you so much, Aaron.
Thank you for your engagement and your thoughtful questions. We'll connect maybe tomorrow, actually. Thank you.
Now, I got Jamie McGarvey asked for friendly amendment. I have to have to change it. I think we need a vote for that, right? So I got a mover here. I got Marianne Stickland and Jamie McGarvey for second. We have a friendly amendment to add to the bottom AMO and FNUM.
I suppose we could add COMO then as well.
Me?
COMO too.
FOMO?
COMO.
I'll ask for a vote. We're just adding it to the amendment, right? You have to vote for that amendment? Okay. Rick Champagne for the amendment. Sarah Inch.
Yes.
Jamie Larry. Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Alex Scott. Tim Shepard.
Yes.
Marianne Stickland.
Yes.
Dave Wolf. Thank you. So I got the same mover and the same seconder for the resolution. I'll read the resolution. Whereas the Ontario Public Health Standard requires public health agencies to monitor food affordability and access and report to the health of local population, describing the existence of impact of health inequities, including the housing and the food insecurity. And whereas the income, the most important social determinant of health that greatly impacts the household's ability to pay for the basic cost of living, including housing and food. And whereas the food insecurity and the housing insecurity have determined impacts on the physical and the mental health, and whereas the 2025 North Bay Parry Sound food affordability results show that the households with social assistance as their main income do not have enough money for the cost of living. And it is therefore resolved that the Board of Health of North Bay Parish Sound Health Unit continue to support in principle the efforts of staff, monitor, raise awareness about where work reduce health inequities include poverty, homelessness, and household food insecurity. And it further resolved that the North Bay Parish Sound Health Unit calls on the province of Ontario to strengthen social assistance by increasing OW and ODSP rates to reflect the cost of living in the Index Ontario Works Rate inflation as part of the 2026 Ontario budget. And therefore to be resolved that the Board of Health of North Bay Parish Sound Health Unit provide correspondence of these resolutions to the district municipalities, Ontario Boards of Health, Vic Fideli, Graydon Smith, John Fardoff, the Honorable Doug Ford, the Honorable Michael Parsa, and Community Services, and the Honorable Sylvie Jones, Ministry of Health, the Association of Local Public Health Agency, Alpha, Pauline Rochford, MP, Temiskaming, Scott Atchison, MP of Parry Sound, Muskoka, and District of Parry Sound Social Service Administration Board, DSAB, and the District Nipissing Social Service Board, DSAB North Bay, AMO, FANAM, and COMO. Discussion on the motion.
Yeah, the only thing I just want to through you, Chair, is there a protocol on this copy? Like who goes first? I know it sounds like a small thing, but
I don't actually know.
no? Okay, I'm okay with all. I just think that there has been some controversy at some point about how the names appear even on the copy too, that it's based on federal, provincial, and then the various ministries and associations.
Don't see
I don't know. I
don't see an issue if somebody else does. Everybody's shaking their head up there also. I think we're good. Okay. Any other discussion on the motion? Okay. Rick Champagne, yes. Sarah Inch,
Yes.
Jimmy Larry, Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Alex Scott, Tim Shepard,
Yes.
Marianne Stickland,
Yes.
Dave Wolf. Carried. In camera meetings, we don't have anything at the moment, or we don't have anything at all. I guess we have an adjournment. Thank you very much for putting your trust in myself and Sarah. And
There's no questions from the media.
perfect. Bailey's pretty quiet over there. And thank you for coming out this evening. And it was a lengthy meeting, but it was for a good cause tonight, especially for our budget and what we're doing. So thank you very much. Good evening. Stay warm.
Good night.